Hi there, everyone, and thank you for joining us for Canceling COVID. It's our platform, real talk, unfiltered information about COVID-19. Our goal is to keep you and your family informed and as well as give you reliable, trustworthy information about what's happening with our community. Now, every day we see the numbers, and boy, are they some really large numbers. We see them in and out every day, but these are actual people. And we've got to understand that this is impacting our lives in so many ways. And we've got to go beyond that. We've got to go beyond the numbers and put a face to what's actually happening in our community. And that's what we're committed to. And that's what we're looking to do. Of course, this is impacting the communities of color in a huge, huge way. And with that said, of course, here in Mecklenburg County, we've been impacted as well as, of course, um, around the country. Right now, we have over 380,000 that have transitioned, passed away as a result of this disease. And if you just take a moment and think about that, this is somebody's relative, again, that they've lost as a result of this pandemic. And the fact that here in Mecklenburg County, we've had 61,000 cases of COVID and 552 deaths. That's according to the Mecklenburg County Health Department statistics that were released on yesterday. Well, close to half of those are people of color, either African American or Latino. That means that, again, the communities of color, we are uh, experiencing this in a very, very heavy manner, and it's impacting our lives. So, what do? We want to inform you, bring you the information that will help to keep you informed, and talk more about uh, real people and real circumstances and how we can try and help get our arms around this. So, today we've got an actual individual who is a survivor who experienced COVID. He's going to join us. In addition to that, we've got a doctor, a frontline worker, who's going to come on and join us as well and have a conversation. I invite you, if you're tuned in, hop online and send us your questions, comments. We'd love to hear from you. In addition to that, we've got information scrolling across the bottom with phone numbers and testing locations, as well as we've got a poll on my Facebook page. We'll talk about that more. But for now, let's get to our guest. And I apologize. I wanted to put that information out. But our first guest is Joe Briscoe, who's joining us. And I want to say, first of all, good afternoon. And thank you so much for taking the time to join us.
Good afternoon, Tanya. Thank you for having me.
Absolutely. So, Mr. Briscoe, you've experienced it, and thank God you're one of the survivors. And I want to talk about what was it like experiencing COVID in your home because you have children and you have a wife. So, let's start with what was or how did you find out?
Well, what happened was we have five children total, and the oldest is away. So with the four in the house, I have an interesting case because for me, I just last year went through a kidney transplant. And so my doctor said for this first 12 months, we need you to make sure you don't catch any colds, you don't catch any flus. So I made it through all the whole year until October. And in October, my daughter, our second oldest daughter, works in sales, and she sees a lot of people. So she works in customer service, and we started noticing she was getting very tired. She was getting very sleepy. And then one particular day, a few days later, before my wife and I traveled, she sat in the room and comforted her and everything. And on our way traveling to the DC area, my wife started coming down with a cough, with heavy fatigue. And then shortly after that, she got tested. When she got tested, she came back positive. My daughter did it, she came back positive. And then in taking care of them, a few days later, that whole week, having a mask on and everything. But I think the contact going up to DC probably is what allowed me to catch it. And so from there, the scary thought for me was, oh my goodness, I made it all year taking anti-rejection medication. I wasn't showing any symptoms that week until that Friday. So I was very nervous, very nervous. And then the fact, what's funny was they started feeling better in their quarantine, and then that's when I started feeling worse. But so those symptoms were pretty common. We had these consistent coughs. If you notice, there's a little bit of issue breathing as you're moving around casually. An abnormal amount of shortness of breath. A lot of times that happen. And then if you have an upset stomach, that can be it too, an extreme chronic fatigue.
So, Joe, you have an underlying condition, and I'm not talking about something that's minor. I'm sure you were very worried and concerned, not just for your family, but also you said you traveled. So, there had to be some concern about your family in DC as well.
Yes, definitely. The moment we found out when Stephanie tested, and it was very favorable that Steph kept herself covered the whole time during our visit. Right away, family got tested from my mother down to my brothers, and everyone came up negative who we were in contact with.
Did you all take any precautions prior to contracting it? I know you had to have heard, and we all know what's happening in the community. So, what kind of precautions did you take prior?
Well, that's what's interesting. I had I had a precaution the whole time of being a kidney transplant recipient. So for me, last year before COVID hit, I was already wearing a mask if I had to go out. I was already wearing gloves. I was already keeping my distance. And so I kept that practice into play. We made sure we washed our hands, everything that they're advising us on from the healthcare profession. We pretty much did that. But I knew that long exposure, being next to someone for a long period of time, if they've been contaminated, I had a feeling. I was hopeful, but I had a feeling. But I was very. I'm not even gonna say nervous. I was very scared, and I was afraid for my life when I found out I was positive. I was actually emotionally devastated because I made it the whole year without a cold, without a flu, and then if anything, I ended up getting it was COVID.
And then, to God be the glory that you are our survivor here to share with us today. And you mentioned your kidney condition. A lot of people that have underlying conditions aren't able to recover. And so, certainly, we are grateful for that. What would you say right now to other families and fathers that aren't taking the illness or the disease seriously?
Well, I do. That's a great question, Tanya. And the main thing I do and continue to do, and I encourage my family to do, is by us making it through and God bringing us through that, I continue to promote wherever I go in small circles at my church home, friends, family, people who I talk to who haven't really had the experience. I really encourage them to protect themselves. And you have a lot of people, fellow Americans, who are very resistant to wearing their mask. They feel like it has issues and they don't really understand how it protects them. And so I take a moment or two to explain that because it's something. It's a virus that you do not want anyone to experience. It is it's very different from a cold. It is very different from a flu. And so I would say stay encouraged, stay connected to family. Your natural supports are everything, and that's what helped bring us through. And if you have a source that you have grown to connect with spiritually, definitely stay plugged into that. If you have people reaching out to you, accept those offers for assistance and help and support. If they want to bring you a meal, if they want to call and check on you, allow these things to take place. That's what helped me and my family get through. And we did that for one another. So those things I think are very helpful to get through COVID.
Canceling COVID, that's what we're talking about. Real talk with Joe Briscoe, a family with children of five, a family of five, and his wife. And he and his wife experienced it as well as the children. And you survived it, an underlying health condition. And we want to hear more stories like this for sure. I was going to ask you for words of encouragement, but you've already provided those as far as giving some great advice to people that are dealing with it. Rely on your resources, your spiritual connection, and whoever's willing to help you. So I certainly appreciate you taking the time to talk with us. And is there anything else you would like to say just to uplift someone that's dealing with it right now?
Uh, all I would say is don't lose hope. Hang on, don't lose hope, and trust that out of all of the emotional and psychological chaos that COVID can bring and having it, because the isolation can be tough. When you're in quarantine and you're just by yourself, so many thoughts go through your head. Try your best to remain positive and try your best to know that things can work out for your good.
Oh, great stuff. So thank you again, Mr. Briscoe. All the
Thank you,
best to you
Tanya.
and your family, and we appreciate you taking the time to join us. Now we have a doctor scheduled to join us as well. Hopefully, we may have to give them a call. It's a busy season right now for doctors, and they're working really hard. The frontline workers out and about, and really, I wanted to talk about vaccinations because that's another conversation that we've got to talk more about. I know he's busy with testing at his location also. And this is an ongoing series. You can join us on Wednesdays and Fridays. It's at 1 p.m. And what we do is we talk about COVID, real talk. trying to assist in getting the word out to the community, whether we're talking about vaccinations, whether we're talking about the mental health impact, the educational impact, the financial impact. It's impacting us in so many ways. There's a poll on my page as well. Please go and click on the poll and let us know if you plan on taking the vaccination. In addition to that, we've got 61,000 cases of the virus here in the state and 552 deaths right here in Mecklenburg County. And that number may be wrong. I believe that's here in the county, rather. Let me correct myself. And the majority of the deaths out of the 552 are African American or Latino. So that's really important. And again, that number I just gave you is right here in Mecklenburg County. We've got some symptoms. You heard Mr. Briscoe talk about his symptoms. Maybe our producer, she can cue and show some of the symptoms that you should look for, because he made it very clear it is not the cold and it is not the same as the common flu. So some of the COVID symptoms that we've got up in the screen right now that we're showing to you, and this is important that you pay attention to the people that you are around, the people that you're working with, the people that you're socializing with. If you see some of these symptoms, then it's up to you to be responsible and speak out, especially in the workplace. The majority of our community are essential workers. So if you're out and someone's coughing or sneezing or saying they don't feel well or that they're tired often, it's up to you to point out to them, you need to go get tested. Testing is available all around the city and you don't have to pay for it. You know, initially there was testing was only for people who exhibited symptoms. Well, that's not the case anymore. Everyone can get tested. And again, if you don't have insurance, that's not a problem either as far as getting tested. There's been a lot of funding provided to these testing locations where you can be tested. Again, we are waiting on our doctor to hop on. We've got a video on Mecklenburg County Health. As you can see right now, I'm waiting for that to queue up. This is the video that shows you a lot of great information concerning COVID and symptoms, whether it's symptoms or steps that you need to take. Actually, that video is about the vaccination. Here we go. Why are more African Americans being hospitalized and dying due to COVID? And we have a lot of underlying health issues. And that's something that didn't just happen overnight. We've been aware of the issue of hypertension, high blood pressure, heart disease, diabetes, and obesity. And these are being impacted by COVID-19 more severely and deadly, and it's affecting our community. So it's about overall health as well. And that's something that we'll talk more about. Things that you can do right now, you're kind of limited because you're inside trying to say practice the physical distancing and wearing your mask. And so the whole issue of trying to stay healthy is a challenge for some as well. But that's also an opportunity. There's some exercises that you can do inside your home. So we'll talk more about that. We were trying to get the doctor on. I'm not sure if my producer was able to give him a call to see if he could get on. But again, notice that we do have a number for you to call if you need to call and get additional information, especially about testing sites. 6 states right now, including North Carolina, as you can see, we've set records for the most COVID-19 patients as far as those being hospitalized. And what that means is if you've got a non-COVID issue and need to go to the hospital, then that creates another issue for you. And we talk a lot about people who have transitioned, passed away as a result of COVID-19. We don't talk a whole lot about people that lost their lives because the hospitals are full right now and you don't have the access or the health care that you would normally get. So the hotline for COVID, 980-314-9400, 980-314-9400. And again, we want to help you as far as how to get information to help you survive, because our community, again, is so much impacted by what's happening around COVID-19. So we're going to have Dr. Washington on as well, who's going to come back with Mecklenburg County Health. He'll come back and speak to us again every Wednesday and Friday about what's happening with COVID. As we start to get ready to wrap things up, I'm getting a cue here that our doctor is not going to be able to join us, and that's okay. We'll get him on. This is live. This is our whole idea of just getting the word out, building here in the community. So again, I've got a poll on my page at Tanya Rivens Live. We want to know if you plan on taking the vaccine or not. If you're a healthcare worker, we'd love to hear from you. Also, keep in mind, we do have a chat box where you can put your comments and join us and just share with us what you would like to hear us talk about as we continue to help get the word out to our community about COVID. We're going to cancel this. That's right. We're going to cancel COVID eventually. It's just going to take some time as we see. It was January of last year when it was first reported. We are approaching the 1 year mark, folks, and we're still dealing with this. But thank God we've got a vaccination now that's available. We've got more conversation. We've got more people experienced it and can share what they've dealt with. So again, I want to say thank you to Mr. Briscoe for taking the time to share with us. He and his beautiful wife, they both had it, and some of their children, but for sharing his experience and offering those uplifting words. So until we meet again, I always say this, as always, life's challenges make you better, not bitter. Hopefully you have a happy and healthy new year, and we'll see you back here on Friday. I know it's New Year's Day, but what the heck? Give us a few minutes of your time.